Good evening. I'm Professor Bipinda Sandhu, and I'm going to talk to you about a paper that Dr. Rao and I have written, which is a review paper looking at the evidence published in medical journals. And we conclude that Black and minority ethnic children more at risk from COVID-19. It's well known about adults, but data has emerged more gradually about children. We all know that COVID-19 affects different groups very differently. Individuals over 75 years of age have a high mortality rate. Children present with very mild symptoms, are often asymptomatic, and generally recover very quickly. Published data from King's College London documented that only 0.5% of those admitted to hospital over 2 months were children. According to Italian data, only 1% of children get severe disease. 21% are asymptomatic. So there are obvious age-related differences, the causes of which remain unidentified. Of the 12 children admitted to King's College, 5 had comorbidities, including 3 who required ventilation. 4 out of the 5, that's 80% children with comorbidities, were from Black and minority ethnic background. As you know, the first 10 doctors to die from COVID-19 were all from BAME background. One of these brave doctors was someone I had known very well as a student at University College London. He came from a very well-off background, so his death could not be attributed to socioeconomic factors. The next shock came when I read a paper published in The Lancet on May 23rd describing 8 children who presented with a new syndrome now called multi-system inflammatory syndrome, temporally associated with COVID-19. Their symptoms were very similar to Kawasaki disease. In addition, 5 had conjunctivitis. All 8 children belong to BAME families. That came as a bit of a shock to me. A recent multi-centre study involving 58 children from a number of hospitals in London confirms that children from BAME background are at increased risk of getting this syndrome. So we feel there needs to be a greater general awareness that children from BAME background are at greater risk from COVID-19. So in conclusion, there's an urgent need for more research to find out the reasons why some communities are at more risk, including possible genetic and environmental factors. It is essential that data on ethnicity is collected in all studies on COVID-19 and emerging knowledge is communicated as soon as possible and effectively to all. Thank you.